The kidneys are bilateral bean-shaped organs, reddish-brown in colour and located in the posterior abdomen. Their main function is to filter and excrete waste products from the blood. They are also responsible for water and electrolyte balance in the body.
The kidneys lie in the abdomen, either side of the vertebral column. They typically extend from T12 to L3, although the right kidney is often situated slightly lower due to the presence of the liver. Each kidney is approximately 3 vertebrae in length. The adrenal glands sit immediately superior to the kidneys within a separate envelope of the renal fascia. Blood enters the kidney from the general circulation via the renal artery, and blood leaves via the renal vein directly into the inferior vena cava. Internally, the kidneys have a unique structure which can be divided into 2 main areas, the outer cortex and the inner medulla. These are easy to identify as the cortex is pale and the medulla is much darker due to its rich blood supply.
The nephron is the functional unit of the kidney. There are about 1 to 1.5 million of them per kidney. They are made up of Bowman's capsule, which collects filtered plasma, the proximal tubule, located in the cortex, the loop of Henle, located in the medulla, the distal tubule, located in the cortex, and the collecting duct, located in the medulla. There are 2 types of nephron. The main type are superficial nephrons. Their glomeruli sit on the outer part of the cortex, and their loops of Henle go into the outer medulla. They have a main role in regulating urine. The other type, which account for 15% of nephrons, are juxtamedullary nephrons. Their glomeruli sit close to the cortical medullary border. Their loops of Henle go deep into the inner medulla. They are important for concentration of urine. Filtration occurs in the glomerulus, a capillary bed that's embedded in the beginning of the nephron. Blood enters the glomerulus via the afferent arteriole. 20% of plasma that goes across the glomerular capillary moves into Bowman's capsule. The other 80% leaves via the efferent arteriole. Glomerular filtration rate is how much blood is filtered by the glomerulus per minute. In a healthy individual, it is approximately 125 mL per minute. The proximal tubule reabsorbs 70% of water and sodium ions in the filtrate produced by glomerular filtration. It also reabsorbs 100% of glucose and amino acids that have been filtered, as well as 90% of bicarbonate. The loop of Henle plays a role in the concentration of urine, as well as the reabsorption of sodium, chloride, water, magnesium, and calcium. It's also the site of action of loop diuretics. The early distal tubule is responsible for the reabsorption of sodium, chloride, water, and magnesium. It is sensitive to thiazide diuretics. The late distal, connecting tubules, and cortical collecting duct play a role in concentration of urine, reabsorption of sodium and water, and secretion of potassium and hydrogen ions into the urine. They are composed of 2 cell types. Firstly, the principal cells, which play an important role in reabsorption of sodium and water, as well as potassium and hydrogen ion secretion into the urine. The second type are intercalated cells. These are important for secretion and reabsorption of hydrogen ions and bicarbonate.
Renal failure and disease. Kidney failure is defined as a fall in GFR, or glomerular filtration rate, and a rise in serum creatinine. Creatinine is a waste product of muscle breakdown, a natural process which occurs every day. As kidney function slows, serum creatinine increases. Kidney failure can be either acute or chronic. Acute is reversible and has an underlying treatable cause. Causes of acute renal failure can be direct physical damage to the kidneys, impaired blood flow, or kidney stones, as well as many others. Acute renal failure is almost instant, and fluid retention develops within a few days. Treatment is required almost immediately, and treatments include dialysis and ultrasound to break up the kidney stones. Chronic renal failure, or CKD, chronic kidney disease, is irreversible and a progressive disease. Although chronic renal failure is not reversible, the progression is manageable and treatable. The disease is easily preventable by following a healthy diet and by regularly exercising. The main cause of CKD is glomerular nephritis. This is a group of diseases causing inflammation to the glomerulus. Diabetes mellitus is the second leading cause. This can be either type 1, where a person can't produce insulin, or type 2, where the body becomes resistant to insulin. Other causes can be hypertension and polycystic kidney disease, a genetic condition where large cysts develop in the renal tubules. There are 5 stages of CKD. The first stage, the glomerular filtration rate, is around 90 milliliters per minute and above. Stage 1 can be easily managed by adhering to a healthy lifestyle, i.e. healthy diet which is low in salt, water and protein. At stage 3, the kidneys are functioning with a GFR of around 30 to 59 milliliters per minute. At this stage, the kidney has moderate damage, waste products start to build up in the body and a person can develop uremia. Stage 3 CKD patients are more likely to develop complications of kidney disease, such as hypertension and fluid retention. Stage 5 or end-stage renal disease, kidneys function with a GFR of 15 milliliters per minute or less. The kidneys can no longer adequately function and dialysis would be needed to live, or if possible a kidney transplant would be needed.